Bismillahirrahmanirrahim. Welcome to the new episode of Health Talk with Newton. Dear viewers, everybody knows about the diabetes as it's very common disease, but people may not know how did they get it. According to the recent survey, globally its percentage is 5% for the age group of 35 to 40 years and 10% for the age group of 45 to 50 years, 15% for the age group of 45 to 60 years, and 20% for the age of 65 and above. But in Pakistan, its ratio is 11%, and more important, its prevalence is higher in males than in females. Today we will talk about this very important and common disease with our honorable guest, Professor Dr. Hamza Muhammad Abdul Ghani. He is Professor of Family Medicine as well as Medical Education. He is Consultant of Family Physicians at King Khalid University Hospital. He is the author of many books on family medicine. He is the certified trainer of NCAAA. Assalamu alaikum, sir.
Okay, alaikum assalam wa rahmatullahi wa barakatuh.
Ji, thank you so very much. My first question is, diabetes is commonly known as sugar, right? So how can we describe it to someone that what diabetes is?
First of all, I have to thank you people that giving me the opportunity to discuss a very important subjects and a very important problem. That's the diabetes. So let us talk about the diabetes. There's a lot to say in the diabetes, but what we can say in the very simple language that diabetes is nothing but the increased level of sugar in the blood of a person who is suffering from the disease called diabetes mellitus, or in colloquial language we can say the sugar. Even in Arabic we call it marad al-sukkari. Why is happening like that? Why the someone who are normal and someone who's having the high blood sugar? Because of some problems. So usually whenever we take our any food, and we need food because the food is going to produce energy for us. So I'm talking, I need energy. I'm walking, I need energy. I'm sleeping, I need energy. So we need energy daily, and the source of energy is the food. So what's going to happen that whenever we eat, there is a metabolism in the body when digestions take place in the stomach, and then and we convert it into so many small particles. It is taken into the blood, and smallest part which is really utilized, it is the simple sugar, what you call glucose, and that glucose to be distributed to the different cells to be utilized as energy. Now these are the things usually carried out by an organ called pancreas, which produce insulin. Insulin is the hormone which is regulate the sugar metabolisms. So this insulin is going to take the sugar and supply to the cells for producing energy. In diabetic people, what happened? That system is lacking. That system is problematic. So either insulin is not able to produce functions properly, or maybe is not there at all. So that's time the patient started having the high blood sugar, and that's the disease which is presented, what we call the diabetes mellitus. So that's a very brief about the what is diabetes.
What signs and symptoms differentiate the types of diabetes?
Okay, so if we really diabetes, we say diabetes mellitus, that's the one we are talking about, the sugar. But the other things you are asking about, the diabetes insipidus, this is a really very different disease. The only diabetes, the word diabetes means something is going on and so on. So what's there? Usually the extra urination, the similarity between the two is the extra urination and the thirst. Now what's happened that in diabetes, what I have discussed, it is a chronic disease due to the problem in the insulin, or from the pancreas, either is secretion or is function. But diabetes insipidus, actually it is a problem either in the brain or in the kidney. And the diabetes insipidus, actually it is a mainly problem in the function of the kidney or producing the urine. Whenever we drink water or something, it goes to different stages and comes to the kidney, where it is purified, refined, and excreted urea and other things which is harmful to the body. But what happened in diabetes insipidus, there is a hormone called vasopressin, which is usually secreted by brain, and that hormone is either is lacking or reduced. So therefore urine is kidney is not able to concentrate the urine and purify the urine, and so therefore patients going to have a lot of urination, and that urine, it is a very diluted, and because he's losing a lot of water, so then also he get a lot of thirst and he start drinking water. The other type of again is diabetes insipidus. It is due to the kidney problem. Kidney is not able to really utilize the hormone what they call the vasopressin, or in other words they call it anti-diuretic hormone. So here the problem is either from the brain or from the kidney. Usually there is, if it is from the brain, we call it central. At that time there is a, say for example there is a brain tumor or something, or the function of the kidney. So these are the two different. In that case, usually we give vasopressin, so if there is other problems, and usually patient get cure. But here there is no cure for the diabetes. It is ongoing chronic problem, and we need a lot of intervention in diabetes mellitus, what we're talking about, the sugar disease.
Instead of this, we also hear about the type 1 and type 2 of diabetes. Is it related with age, or some other factors are involved in it?
So now, as you ask that what is type 1 and type 2 diabetes? Actually now we are talking about the types of diabetes, or the classification of diabetes mellitus as a disease. There is a lot of classification, but the agreed classification by the American Diabetic Association, or WHO, it is under the 4 headings: diabetes type 1, diabetes type 2, and gestational diabetes, which comes into the pregnancy, and some other things, because the majority of the cases are type 1 and type 2. So what is the difference between the type 1 and type 2? Usually type 1, which comes into very young age, usually in the children or maximum adolescent and so on, and where there is a destructions of the cells which is responsible for the insulin production, and there is a complete absence of insulin, and this young patient, they present lack of consciousness and so on. So that's that, and usually it is diagnosed very early. So high sugar, insulin is not there, so it's not working, so metabolism is all upset, and there's a lot of problems with the patient having severe vomiting, drowsiness, sweating, even go for the coma or the unconsciousness. But and this is, fortunately, it is only about 9 to 10% of the all diabetes. Will not go beyond the 10%, or so maybe less than that, different. But the majority of the cases, that's diabetes type 2. And what is this diabetes type 2? Usually comes into the older age. There's usually family history of that. Usually patient having obesity. So there are certain risk factors which can produce type 2 diabetes, and it is not diagnosed early as in case of type 1 diabetes, because patient goes a few years and he are not aware. It's very slowly progressing chronic disease in the type 2, where when we just doing a routine blood test, so fasting blood sugar which is high, so then we say, oh, you're possibly having diabetes, and or patient comes to us and say that, doctor, I'm nowadays I'm really urinating a lot and have a lot of thirst, and so I can remember one of my patient who was in Hajj, and he came and he said that, doctor, I used to drink a lot of water and then I urinate during Hajj. And he said, because I'm working, I'm going in sun here and there, that's why. But I came to Riyadh. Riyadh weather is quite good. And even that I'm having a extra urination, and even sometime at night I get for 2 or 3 times to go for the urinate. So what could be? I said, anyone in family diabetic? Yes, my mother is diabetic, my father is diabetic. So type 2 diabetes, it is usually familial disease because of, and certain other extra factors which can lead to type 2 diabetes. The problem is here that it is delayed, and that's why usually we say that if you have family history diabetes, if you are obese, if you are above 30-35, please check your blood sugar every 6 months to 1 year to find out if you are not prone to diabetes.
Thank you so very much, sir. Here is another important question. What is the very common symptoms of diabetes, or how a common man will know he is having sugar or he has been infected with sugar?
How we know that someone is having diabetes or he got infected with the diabetes. Now here, before I start with the symptoms and how they present, the word infected will not fit with the diabetes. Diabetes is a chronic disease which starts slowly in case of type 2 and abrupt in type 1 and remain for the whole life. And when we talk about the infections usually the diseases which is produced by the microorganisms. So for example, influenza, for example, hepatitis, for example, nowadays the very famous novel corona. The 1,000 people are dying and getting infected, and so there is usually a microbes which producing the problem. That time we can say that this is infectious disease or is infected. But in case of diabetes, yes, you can say that when it can start and so on. So if by any mean in children the cells are in the pancreas has been destroyed, and usually they say some viral and so on. So if it's destroyed, then the patient can have diabetes type 1, or in the olden age, maybe usually after 25 or 30, when they are obese, they have family history of that, they are taking a lot of food and so on and gaining weight. So these people are going to produce diabetes. Now coming to the presentation, so as I said, for the type 1 it's easy to diagnose and so, but in the type 2 it remains for a long time. So patient can have asymptomatic, no symptom at all, and when he goes for general checkup, sometimes they let us get the checkup, and when he gets checkups and he found that, oh, his blood sugar is high. When it's very advanced, then patient they come and complaining of, as I said about the patient who came from the Hajj, and he was telling that. So if patient really started having main symptom is increased thirst and an extra urination. Also they feel that they want to eat more, so there will be more other things that people, they start losing weight. Also they feeling tired, they are not well, they get extra infections and so on. This is all these in the later stage. But the main things we can say, what we call it in the medical terminology, polyuria, polyphagia and polydipsia. So increased thirst, increased urination and increased appetite, we are taking a lot, and even that you're losing weight. So he was quite heavy and so on. Now he said that I have lost weight. So that's some presentation of in the later stage, even some certain complications like the eye problems and so on can also produce. So that's the presentation of diabetes, a chronic disease.
What diet should be taken by a sugar patient, or is there any diet plan for a sugar patient? Please share it with our audience.
Very nice questions, that what they should eat. Now I'm having diabetes, so I should not take sugar, I should not take So what I should not take? Let me tell you that yes, diet is the very important part of our management with the patient with diabetes. But we should not forget that when the patient started having diabetes, so we will start usually certain medication, especially in the type 2. So we start certain medication, you can say pills, diabetic pills and so on. Along with that, we always say that take your diet, balanced diet, you should what. So we say that for the normal person, usually we say that I'm sedentary life, we don't need more than 2005 calories or maximum of 3000. But if you take a lot of food and so your body is not able to really utilize those, and you're going to have the problem with that. So accordingly, we start the pills, and along with that, usually we say that don't try to avoid that really refined sugar. That don't add sugar to your and your tea, and your coffee. Take brown bread. Avoid your rice, plain rice, something. No more halawa or what you call sweet or so. These things will make harm for you. Take a lot of fruits. Usually in such case, we ask our patients to sit with the dietitians and make a plan. So I'm obese. I need to cut off my calories to reduce our weight. And when you reduce your weight, you are going to help a lot for your diabetes or for your sugar. So reducing the calorie intake under the supervision of specialist doctors and nutritionists is going to plan for you. We should not forget that 3 pillars for treatment of diabetes is the medication which is given by the doctors, your balanced diet, and your exercise or extra activity. These are the 3 main plan for any diabetic patient.
Does eyesight have some connection with diabetes? If yes, how it can be prevented and to what extent?
So now we are coming to the very important things, the complications, and as you asked about the eye problems. Now let me tell you, it is a chronic disease. Diabetes is a chronic disease, or the sugar is a chronic disease, and we treat not only to stabilize the sugar, but also to prevent the complications. And there are a lot of complications in the problems in eye, problems in kidney, in heart, extra infections, in ulcer over the leg, and so on. And they classify into the 2 type of infections, microvascular and the macrovascular. Microvascular, that's the affecting the small vessels in eye and kidney mainly. So they are in eye. Patient start usually in case of patient start seeing blurred vision or so. Sometimes there's nothing in beginning. That's why whenever we diagnose type 2 diabetes, and usually type 2 diabetes, we say that it is there with the patients maybe more than 5 years. So immediately the first visit of a patient who diagnosed in the type 1, we say that you should be seen by ophthalmologist. What they do, they look for the vessels, that where is affected. So they look at the retina and inside the eye, and they do sometime, if there is some problems, they can do the treatment like by the laser therapy and so on. So therefore, instead of going away, so initially maybe patient is not going to see anything, but it is already the effect started, and usually it is a very early effect on the eye. Simultaneously, again in the kidney, they can lead to the kidney failure. It can produce the heart attack due to the affected blood supply to the heart. It can produce infections. It can produce the problem in the legs and so on. So yes, there's a lot of blind people due to problems because of the diabetes, or people who lost their kidney and what they are already dialysis. They go for cleaning of the kidney and so on every 2 or 3 days, or a patient can have a heart attack due to the diabetes. So these are the certain common problems with the diabetes as a complications. A strict treatment, more control can delay all these complications. May can come any time, but usually it is delayed and patient can have the healthy life.
Thank you so very much, sir. Going bathroom more often in winter is common because people take more coffee or tea in cold weather. So is this a sign of sugar?
So drinking a lot of water and going for bathroom for urination, is it a sign of diabetes? Especially in the winter, sometimes we feel a lot of urination. So in one way, yes, it is a, but be careful that is it your habit or it is started recently. We can say that yes, if you some people they like to drink a lot of water and they urinate. This is usual, but it was not your usual, and now it is something is coming unusual. That's the one which we can say the diabetes. But whenever you have extra urination, you started thinking a lot of drinking a lot of water, why not to get checked? It's a very simple test. So just fasting blood sugar can tell us that you are diabetic or not, or so on. So yes, we can say it is a sign of diabetes, but not for all. And if I drink a lot of water, I urinate a lot of urination and so on. So that's very brief about the extra drinking and extra urination.
Here is one question from our viewers: how we could get treatment of diabetes either by taking insulin or simply the diet is more than enough?
Okay, coming to the most important part, the treatment, and I discussed in between here and there, but let us again take it that is it insulin, it is pills, just tablets, or it is, so it is a mixture of all. So what are the options for that? We have certain pills, there are a lot of tablets are there, what you call, there is insulin, and no doubt that the exercise as well as the diet control should be there. Now I have discussed about already the diet control and the exercise. Let me add just to the exercise, at least half an hour per day activity is to be done by diabetic or any other person. Now coming to the insulin or tablet, where to start? Usually type 1 diabetes, which are where we say that insulin is not there at all, that time we have to start with the insulin. But in case of type 2, usually we start with the tablets, pills, what we call anti-diabetic tablets, and we start with the exercise and dietary control and so on. But any patient who is having started having the diabetes type 2, in long run he is going to go for insulin, no doubt about that. So sometime we in initial stage we start with the very severe sugar. That time we start insulin. Someone can say that you said that insulin is there but it's not working, so we help the patient through the extra insulin, that even a small dose. But in the long run, if the disease is, we start sometime with the 1 pills, and when we add to 2 pills, 3 pills, and go for the 7 and 8 pills and so on, and not controlling, and that time we go for insulin, adding the insulin small dose, and sometimes we go for insulin with the tablets. So that's so not to forget that insulin, tablets, exercise and dietary management are the cornerstone for treatment of diabetes.
It's very common observation in any feast. People take everything, eat everything, the sweet dish, so much so. But at the time of tea serving, they say no sugar because I am diabetic. So is it the correct myth, or there is something else
Okay, that's really very funny questions. Yes, we have seen. Especially you will see in when there is a big gathering and there is a huge dinner party or lunch party and so on, and our guest he takes whatever he wants to take, and huge and in our culture in Saudi Arabia, what we call mufattah, when there is a full goat on the one big plate with the rice and so on, and they enjoy all and every type of food, even sometimes Pepsi, sometimes dessert, all this. And then we bring tea to him, and he said, "Oh, you don't know that I'm a diabetic. So there is sugar or not sugar? No, this is with the sugar. No, I can. How I can so? So these are the certain myths, and I think that people, they think that only having the sugarless tea is enough. It's not like that. But sometimes I just say to some of our people, some of our known person who is having diabetes, that okay, enjoy, break one day, but it doesn't mean that you take the sugar-free tea or coffee and that's your okay for your whole things. No, there is a really a program diet, what we call balanced diet, should be for that, and not only the sugar, adding sugar to the tea.
A person who is from low socioeconomic background and he is having a diabetes, how he could fulfill the diet requirements?
Okay, so I think this is again important questions, that a person who is from the low socioeconomic background, how he can fulfill his diet requirement. I don't think there will be problem in the diet requirement, but the problem with the taking the medications, and especially who are gone for the insulin. Diet is just, we say, the controlled diet. You take more of vegetables, more of salad, reduce your taking rice, take it. I mean, yes, so somehow patient is who is diabetic, he has to take care, but I don't think there will be much problem in dietary balanced diet taking than the medication, because I know some of the people who cannot afford the insulin. Insulin is expensive, even the type 2, and so some of the medications have become expensive. And not to forget that diabetic people, they have hypertension as well as problem in their lipids, cholesterol, triglyceride, and so on. So there is a diabetes is a multi-system disease, and then if the patient having diabetes and hypertension, they have to take that medication for diabetes and hypertension. If he having the diabetes and hypertension and dyslipidemia, or what called the problem in the lipids, so he has to take also the medication for that. So that's really burden. So how I can manage that? Alhamdulillah, we in our society that treatment is free, or either you can go for the insurance, health insurance, and so on. But you cannot just leave your medication for diabetes. It is a killing disease if you don't go for the medication.
Glucometers of different companies are used to measure the sugar level. Are these devices trustworthy, or we should have to go to the hospital?
So now again, especially people who are using devices to check what we call home monitoring, definitely in type 1, where there is a frequent and at least daily, or sometimes more than once in daytime, they need to get their so they have to have the device at home. And even for the type 2, so home monitoring is as an important. Now there is a lot of devices in the market, and they are all, I mean, they are good. Sometimes they just need calibrations and so on. But mind you that these devices are usually just a small prick in the finger, and then they can tell us the reading. Reading is slightly different from the which is from the veins and so on. But this gives us very good idea. Like, say for example, a patient who is having insulin, and suddenly he started having sweating and dizziness, and he's not able to walk. So maybe he's hypoglycemic, or maybe same time he's hyperglycemic. So keeping the device and set and see that maybe he's having 200 or 300 or 400 sugar, or in the other side that is having a 50 or 40 blood sugar. So that time really we have to diagnose if especially hypoglycemia, or the less sugar in the say patient has taken, say, for example, insulin, and he has delayed his eating, then he's going to go for low blood sugar, and this can produce a lot of problems. So device, I think for any patient who's having, they should have, especially for the type 1, and I think majority of these devices I have seen in the market, they just need some calibration and so on, and they can utilize it. This use is also very simple. There's no problem about that.
Thank you so very much, sir. Next question is, a lot of research is going on diabetes. You are doing too. What is the latest update about the treatment, and is there any vaccination for it?
Now the question is that what is the latest news in the treatment of diabetes, and is there any vaccine which can really prevent having diabetes? Good question. Yeah. There is a lot of research are going on in diabetes, no doubt about that. So many new anti-diabetic medication has been introduced. Even insulin has now come as a once in few days, instead of taking daily or twice or 3 times daily. Certain medication which can be taken, people are looking for. So things are going on, research are going on, but not in case of for type 1. Even the stem cells and cells transplantation for that, for the pancreatic, some success has come, but all these are under experimental level. Is not that which is really taken as a. I think again I repeat here that your medication which was advised by your doctors, your diet, controlled diet which has been discussed with your nutritionist, and your activity is the major things about the control of diabetes. Coming to the vaccination, is there any vaccination to again I can repeat which we discussed earlier. It's not infectious disease vaccination usually for the infectious disease, say for hepatitis, influenza, chickenpox, and whatever it is. These are the things where we can have the vaccine. So, but when you have asked about the question of the vaccines, now because diabetic people, they are prone for more infections, so we recommend certain vaccines to prevent those infections, especially in the older ages, especially the patient is more than 60. So usually say that diabetic people that take influenza vaccines yearly, pneumococcal vaccines. Pneumococcal pneumonia is very dangerous in case of diabetic people. Take again to prevent that, because pneumonia in older age is killing. So they just take once. And also we screen for hepatitis. If we don't have the hepatitis positive marker, or so we give also hepatitis vaccines. So vaccines to be given to the diabetic to prevent certain other infections which are, and as we said earlier, that there is the immunity which is reduced in case of diabetic people. So we have to give some extra immune mechanisms to reduce that. So definitely taking the influenza vaccines, taking pneumococcal vaccines and hepatitis vaccines, especially in the older age, it is recommended for any diabetic patient.
One more question. Is there any link of hepatitis with diabetes?
This is again very nice questions, that there is any link between the hepatitis and diabetes. We have seen that the prevalence of hepatitis is more in diabetic people than the normal populations, and that's why just a few seconds ago we discussed about the taking the vaccines and his hepatitis. So usually if a patient is diabetic, we give vaccine not to mean is a relation between two. Yes, they are more prone for diabetes, but I haven't found. But if you want to look for the relation between the other diseases, especially the type 1, which is the autoimmune, they have certain other autoimmune diseases, like just simple vitiligo is autoimmune disease. They can have that. Certain thyroid problems like grave disease is autoimmune disease, and so on. Pernicious anemia is autoimmune disease. So usually when we have type 1 diabetes, we screen people for their other autoimmune disease. But I don't think that patient who's having hepatitis is going to have diabetes. I haven't come across. But who is having diabetes, they are more prone for any infection, including hepatitis.
How we could prevent ourselves from being diabetic?
So that's again, and I mean, prevention better than cure, what they call it. So prevention of diabetes is again very big topic, and every time we keep in our mind, we as a health professional, everyone should work for prevention. You cannot prevent type 1, and fortunately type 1 is less than 10%, 7%, 8%, less than 10%. The majority of diabetes, what we see, they are type 2, which is usually come in a later stage, 30, 35, 40, after 40 or something like that. Now there are certain risk factors, and we discussed earlier also. A person who is in family, family member is diabetic in my family, so I'm more prone for diabetes. If I'm obese, I'm more prone for diabetes. If I'm having sedentary life, I'm more prone for diabetes. Recently, ADA, if I'm having hypertension, I can have also diabetes, and so on. People who we discuss about the gestational diabetes, people who had diabetes during pregnancy only, and after pregnancy they are okay, this is gestational diabetes. They are also prone for the type 2 diabetes. So people who are on the high risk, usually we recommend that after 30 or 35, you start checking your blood sugar yearly, 2 yearly, and so on. Keep eye on your weight. Take the healthy diet. Nowadays junk food, and so we have a lot of calories without anything, and so on. So having the healthy diet, keeping eye on your weight, and activity, I think these are again 3 main important factors to prevent the diabetes, especially if there is a family history. You are prone for that, and we have seen that people who in the family, if the father is becoming diabetic after 40 or 50, the son is going to diabetic after 30. So we have to have eye on our normal blood, our normal weight, our healthy diet, especially who are prone for, and the activity. I think these are the 3 things which we can prevent that producing diabetes. I should not forget the pre-diabetic people. They have to work hard to become normal.
One more very important question, sir. What level is called the normal percentage level of blood sugar?
So sugar level, actually this is the one who can tell us that patient is diabetic or not diabetic, and I have discussed earlier that there is the third group which are pre-diabetic. So if we take in the milligram, we say that if I'm normal, my fasting blood sugar, and again to define fasting blood sugar is that for 8 hours fast with non-calorie. This means that if I drink water does not mean that I am not fasting. So if I'm fasting for 8 hours and the blood was taken from my veins, and this if I'm normal, so my blood sugar should be less than 100 milligram per deciliter, or less than 5.5 millimole. per liter. That's the normal person. And whenever our fasting blood sugar is more than or equal to 126 milligram per deciliter or more than or equal to 7 millimole per liter, that time we can say the patient having diabetes. The in between, the level which is between the 100 to less than 126 or between 5.5 to less than 7, this is the one what we call the pre-diabetic. There is another criteria to again diagnose that, that's the 2 hours or casual. Anytime when I take the blood sugar, it should not go beyond 140. Or more than 200. So if it is going more than 200 at any level, patient is diabetic. Or so this means that at any level it should not go more than 140 or 8. That's the one which we are taking that. So if I'm between the 140 and 200 again, so then again we are pre-diabetic. The third criteria, again taking hemoglobin A1C. I don't want to go in details because some of them is still WHO. They put as WHO as well as the ADA, American Diabetic Association, put as a criteria. But usually we hemoglobin A1C we take as a prognostic value and not the diagnostic.
Thank you so very much, sir, for giving us the very important nuggets of advices. Thank you.
Again, I should thank you people that giving the opportunity to discuss very, very important problem in our community, diabetes mellitus. Thank you very much.
Yes, viewers, today we have discussed about diabetes with Prof. Hamza. So let me summarize the whole talk. Diabetes can be recognized by some symptoms: polyphagia, polyuria, and polydipsia. Polyphagia, you start eating more. Polyuria, you go to washroom frequently. And polydipsia means you drink water more. These are the three main symptoms of diabetes. If you see any one of these changes in your body, please check your glucose level with glucometer. If it is between 80 to 100, then your sugar level is normal. Your diabetes level is normal. But if it is more than 140, then you must have to see the doctor and take the proper medication. For diabetic patients, it's my advice, please do not take those foods which are rich in carbohydrates like white rice and white bread. Do not control your sugar just by taking without sugar tea. You have to consider the other things also. Diabetes is a preventable disease. With this message, see you next time. Bye-bye.